Well, hi, I'm Matt McKeever. I'm a radiation oncologist. A radiation oncologist is a doctor that treats cancer patients with radiation. Just a little bit about me. I was born and raised in Yukon, Oklahoma, so went through high school up there. Then I went to OU for undergrad. When I went to OU, I didn't know what I wanted to do. I kind of just I found medicine because I thought it was something that you could really help people with, can really kind of improve their lives and something meaningful. So that's kind of why I picked medicine. So I did my undergrad up there. Eventually went to med school, a place called UT Southwestern in Dallas. When I went there, I had no idea what radiation oncology was. It's a real small field, so not many people know about it. Not a lot. Some doctors don't know about it. It's one of the smallest fields in medicine. But when I was there, I was doing my classes, and they have an interest group in radiation oncology. And they had a free meal. So I went for the free meal, but when I was there, they kind of talked about radiation. They explained how you can kill these cancer cells with an invisible beam of energy, which is what I do, and I thought that was amazing. So I started shadowing some radiation oncologists, went to residency at a place called University of Chicago, and then that's about 5 years of that. So I was there training for quite some time. And then when I finished up there, I went back down here, down to Lawton. I started my practice down here. At your stage in the high school kind of time period, things that can help you is really doing good on your schoolwork, getting good grades. Your grades are kind of a reflection of your knowledge base, right? So right now, you're kind of building that knowledge base you're going to use going forward. It's good to excel in kind of the math and science portions of it. There's a lot of that in your undergrad classes that are required for medical school, and then also for your med school, obviously. So once you get out of high school, you have to go to usually a 4-year undergrad and get a bachelor's degree. And then you can go to a medical school. So we have the medical schools in Oklahoma are the OU one and the DO school at OSU. Both of those are good schools. You'll attend those for about 4 years. So 4 years of undergrad and then 4 years of med school. And then you can do the radiation oncology residency. It's about 5 years total. 1 year of that is something called an intern year, where basically you just do prelim medicine. The other 4 are actually radiation oncology / oncology training during that time. So you do 5 years of that, and then you go into practice, essentially. So radiation oncology is kind of a unique field in that we treat cancers all over the body, right? So we're almost a generalist in that sense, but we give one specific treatment. So I have all types of different patients, prostate cancer patients, breast cancer patients, and lung cancer patients, metastatic patients. About 50% of all cancer patients eventually get radiation of some sort. So I'll see me in a consult, I'll see them, I'll talk them through the risks and benefits of radiation, why they need the radiation, how the radiation treatment will work, and then after that we do something called a radiation planning scan. It's kind of in the details, but it's a CT scan. We take a picture basically of their body, and we use that picture to make a radiation plan. Quite a lot of teamwork to do that. I'd work on it, a physicist works on it, and someone called a dosimetrist works on it. Dosimetrist is a specialist to make radiation plans. So we'll go in there and we'll kind of draw out the target we want to treat, and then draw out the areas we don't want to treat, and then we target the radiation to the spot we treat, and we spare the areas that we don't want to treat. We're really accurate with our radiation, get down to like millimeter level accuracy, so that's been a real advance in the field. Used to not be that accurate in the past. Basically what will happen is they'll come in and lie on a machine. The machine will take a kind of like a CT of them. They'll line them up just right, the machine, and then they'll treat them. This is the vault. This is where we have our linear accelerator at. As you can see, there's a big steel door here. It's huge. And that's to prevent any radiation from getting outside the area. You can't see it, but the wall here is incredibly thick and full of concrete, and that's again to reduce the radiation from not getting outside, so it doesn't get to our dosimetrists or our therapists or me, right? So we don't get any radiation dose. So on the inside, we have the actual linear accelerator. That's this big machine on the wall you see right there. Down here is our table. It moves in 6 dimensions, so we'll get people on the table, we'll get them lined up to the machine, and then the table will move to get them lined up just right. These things on kind of the side of the layer accelerator, these 3 things, those are imaging devices They can allow us to get x-rays and chrome beam CTs of patients to help them line up right. When we treat a person, we'll have immobilization devices with them. So like for people who have cancers of the head and neck region, we'll make a mold of their face. It'll look something like this. This will go on their face and it's custom made for them. So it'll be fitted very tightly to their face so they can't move one way or the other very well. It has holes in it so they can see out of it and breathe out of it, but it doesn't allow them much movement, so we can get a very accurate setup. And we also have things like backlock bags and Q-fix bags. What these things do is basically if we're treating somewhere that's not the head and neck, we put them around them as kind of a mold that kind of holds them in place. Just another way to immobilize them to get an accurate setup. So I'll see them pretty frequently during treatment, about once per week, and then afterwards I'll follow them kind of long term, usually up to 5 years or longer. I'll see them, depending on the cancer, every 3 months, to every 6 months, to every year. It's real nice though, because you get to build a real relationship with your patients. They'll see you, you'll see them in the hard times when they're on treatment and getting chemotherapy and things like that. And you'll see them in the good times when they're off treatment and they don't have any disease anywhere. So you get the real highs and you get the real lows. So you do kind of build a real relationship with them. One of the really fun things we do here is when a patient finishes their treatment, and sometimes a long course, right? Something can be up to 8 weeks. We have a bell here, and that symbolizes them going from being treated to being done. And some of those patients love it. Sometimes they go real hard to that bell. I'm worried they'll rip it off the wall sometimes, but it's really fun to watch and be a part of. It's really rewarding to treat patients who have cancer, to help them cure them their disease and help alleviate some of their pain and suffering.